So I think Glucare and iChom can enhance the basis of value-based healthcare in the UAE just by having first mover advantage or implementers in value-based healthcare. Today we have a healthcare landscape that has no history of reporting or measuring outcomes. So it's very important that somebody starts this process, somebody goes through the process and starts reporting transparently so that there's some accountability, and that regulators, other providers and payers all see that there's a new player or a entity, in this case Glucare, that is actually reporting these outcomes transparently. For Glucare, it was relatively simple because we started from scratch. So when we first set up our first clinic, we had all of these tools. All our systems were geared towards measuring outcomes from day one. So there was no legacy that we had to deal with. The outcomes we achieved within 1 year, we started reporting them. For example, we had a significant reduction in hemoglobin A1C in our case because we're a diabetes provider by 1.7%. And then we relooked at our processes, how do we improve them, what do we need to tweak in them, and then we further improved it. Now we're currently hitting a 2.1% reduction in hemoglobin A1C in as little as 90 days. So we continuously look at our data and try to improve and iterate in our processes. For us, it was very important that we collaborate with iChom to get our accreditation. As many people know, we were the first organization to get that. When we're starting with a new healthcare model, in our case what we call hybrid healthcare, we need to actually prove out that this type of healthcare, this hybrid healthcare, is better than traditional healthcare. And in order for us to do that, we need to measure against some level of data that is recognized globally. And in the case of diabetes, there is no better subset than the diabetes standard set. So now we can compare traditional care that follow the iChom standards, and in Glucare's case, the hybrid care model, and we weigh out which is actually improving, and that's kind of our strategy moving forward. Anything new that we do, we will use the standard sets to prove out that this care model is better than what is previously or traditionally practiced. The direction that healthcare or value-based healthcare is going is that today we have a system where providers and payers simply do not have a relationship that is based on future-looking pathways. It's a very difficult relationship. Payers always feel like providers are costing them too much. So I think value-based healthcare sorts that out. It's very simple. If you actually produce outcomes, you should get paid higher. And if you don't produce those outcomes, you'll get penalized or get paid lower. It's very simple. It's a win-win situation for both. The challenge is to start implementing it with payers. And the challenge there is that we usually have 12-month insurance cycles, contracts, very difficult to do a return on investment in larger or longer durations. And as you know, in chronic disease management, the return on investments are usually much longer. But there are many other specialties in healthcare other than chronic disease that can have an immediate impact on the return on investment. So I think the path forward is that if payers want to be relevant, they have to start looking at some level of value-based reimbursement contracts in the UAE. So the iChom conference is very valuable to the healthcare community because we actually learn and look at real-life examples that have been tried. We look at payer models that have worked, providers that have thought outside the box. It's not easy to start changing workflows to capture all this new information, and then the thought process of what do you actually do with this information and why does it benefit me? Why does a provider need to provide or get all the resources in order to come up with an iChom full standard set? So we learn. There are a lot of peers in the market. People come and learn from us. We're in one part of the world that value-based healthcare today is not implemented. There are many parts of Europe where value-based healthcare, and in the US, that are implemented successfully. So we're here to learn, we're here to hear stories, and we're eventually, the mindset for us is we have to implement. And if there are implementers today in this conference, then we certainly want to talk to them.